Getting logged in. Good evening, and thank you for joining us tonight. My name is John Ekman. I'm the director of the VA Maryland Healthcare System. I'm really happy to be here for this wonderful forum. The purpose of today's gathering is to share information about the programs and services available for our women veterans throughout the VA Maryland Healthcare System, and to better understand your healthcare needs and to gather any feedback you would have for us to ensure we are providing safe, quality, and compassionate care in a sensitive environment. We have had lively discussions during our last forums, and your valuable feedback allows us to better address the needs of, for yourself and for other women veterans throughout our healthcare system. We host these women veterans public forums twice a year to help address any ongoing healthcare needs and to keep you aware of the latest of programs and services being offered to support women veterans. So look for another invite in the next 6 months. Today's forum will be recorded and posted on our website. To view the recording, please visit maryland.va.gov about 48 hours after the forum. Once again, that's maryland.va.gov. To protect your privacy, we all ask that you don't share any personal health condition or any personally identifiable information during the question and answer portion of the forum. Please use the chat option to post any questions you might have. Microphones, keep them muted unless you're asking a question. And if you have any specific medical concerns, please contact your VA provider. Thanks again for joining and for sharing your feedback. Before we get started, I'd like to introduce Dr. Sandra Marshall. She's our Chief of Staff for the VA Maryland Healthcare System for a few remarks. Dr. Marshall? No worries. We'll go back to Dr. Kirksey. We can probably go ahead and get started and see if Dr. Marshall had anything for us in the future. Dr. Kirksey?
I appreciate that. Thank you so much. So I just want to welcome everyone for joining us. Before we get started with the agenda, I'm going to see if Dr. Starpoli has any remarks for our group, and then we'll go ahead and get started.
Hi, thank you, Sobhan. I'm Dr. Catherine Starpoli, and I am the Medical Director of Women's Health here at VANIX and have been so for quite a number of years. And I wanted to welcome you all to our forum.
Thank you so much, Dr. Starpoli. So just a quick little agenda so everyone's aware of what we're covering. We're going to do a high-level, just quick overview of our women's health program offerings. We will talk about the difference between comprehensive women's health care and gynecological specialty care. This has come up a couple of times in regards to some additional feedback that we have received from all of you all. And so we want to make sure that we help clarify the difference between the two within the VA system, because it does look significantly different than what we see in the community. We'll talk a little bit about our menopause care. We will also talk about IVF or in vitro fertilization. Then we'll highlight some new happenings, and then we will leave it up to you guys to put any questions you may have for us within the chat. So I'll go ahead and get us started and keep us moving. So just as a reminder, our women's health program offers our women veterans comprehensive primary care, comprehensive health care, which includes primary care, gynecologic care. We do maternity care as well as fertility and infertility services, childbirth education classes, and postpartum support. Our postpartum support goes through 12 months, where it used to be, a couple of weeks or so after delivery. We actually now cover 12 months of support for our postpartum veterans. We have a lactation consulting clinic. We still provide ultrasounds and mammograms, partnering with the community if need be, but all those services are also available on site. We provide mental health care and counseling, as well as lifestyle whole health wellness services, menopause clinics, which we'll highlight tonight, and our pelvic floor physical therapists. Because we did not have the opportunity to have Dr. Marshall give remarks, I just want to take a quick moment to introduce our team. So
I'm back.
You're back? Okay.
Yeah, the system right when you got to me just cut me off. Just why we love technology, isn't it? But welcome.
Yeah.
I'm sorry, I'm on my phone right now. Still trying to get my computer to boot up. But as Dr. Kirksey said, I'm Sandra Marshall. I'm the Chief of Staff here at the VA Maryland Healthcare System. It's been my pleasure for many years to serve our women veterans. And so I've been on many of these forums, and I'm really looking forward to hearing your feedback. to help us better serve you. As she mentioned, we're going to go around and I'll introduce the people that are on the forum with us. There's myself. You met Mr. Ekman a few minutes ago, our medical center director. Dr. Catherine Starpoli is our director of women's health. Dr. Sobhan Kirksey is our women's health program manager. Ms. Janita Robinson is our maternity and women's health care coordinator. We have on with us today Dr. Rachel Austin, the Women's Health Program Mental Health Champion. Ms. Maisha Pope, the Women's Health Senior Social Worker. Ms. Syed Yates, the Women's Health Pelvic Floor Physical Therapist. And Ms. Lindsay Wilson, our Intimate Partner Violence Coordinator. So now, as we've made the introduction and Dr. Kirksey is kind of giving you the agenda, we're going to go ahead and turn things over to her and Dr. Starpoli to do their presentation. So thank you very much.
Thank you, Dr. Marshall. I appreciate that. So to move us to our next slide and keep us headed in the right direction, we're going to talk now about our comprehensive women's health care versus our gynecological care. So our comprehensive women's health care here at the VA focuses on a holistic whole person care, including prevention, wellness, and management of chronic conditions. We address general healthcare needs across the lifespan. So we focus on things like hypertension, diabetes, and mental health, as well as any immunizations. We incorporate routine women's health, such as pap smears, breath exams, contraceptive, and menopause counseling. We act as, for many of you, the first point of contact for healthcare, and we help coordinate referrals to specialists, including our GYN team. We emphasize continuity of care, health maintenance, and patient education. We manage both acute and chronic non-reproductive conditions alongside with reproductive health needs. And we often are provided care by either a family medicine provider, internal medicine provider, or women's health nurse practitioners that are on the team. So one of the things that is significantly different with us is we do all of your women's health care right with that primary point of contact. When you are in the community, at times you see a general primary care provider, and then many of us may see a GYN. For us, our GYN is considered a specialty. So your comprehensive women's healthcare clinician is the one that's going to manage all of your healthcare needs, including your well woman needs. And we use our GYN team a little differently here. They specialize in our reproductive system. They offer expertise in complex gynecologic conditions. They are able to perform advanced diagnostic procedures, things like a colposcopy, LEEP, heteroscopy, and minimum invasive surgery. To get into our gynecologic clinic, it is a consult that is sent from your primary care team. So your women's health provider is generally setting up that consult because GYN is treated like a specialty here. They also do management of abnormal uterine bleeding, fibroids, endometriosis, and pelvic pain. They provide subspecialty care such as our urogynecologic, reproductive endocrinology, and gynecologic oncology if need be. At times, that gynecologic team may also do a care in the community referral to our partners at the University of Maryland to help support. Our urogynecology specifically addresses pelvic floor disorders, urinary incontinence, and pelvic organ prolapse using both surgical and non-surgical treatments if necessary. But we also have our amazing pelvic floor physical therapist, which either your women's health provider or the gynecologic team can send a consult over to that team to help address any pelvic floor disorders as well. Oftentimes, the referrals come from comprehensive women's health care to provide additional evaluation for treatment of complex or surgical cases. It does not typically manage chronic conditions. So they are not going to be the team that manages your hypertension or your diabetes. At times, when you are started with any care for, let's say, menopause, for example, they may want that care to be continued and coordinated through your primary care team, and that is plausible that it's able to be done. So they are focused primarily on reproductive health concerns rather than the whole body and wellness like your comprehensive women's healthcare team is. Dr. Starpoli, do you have anything to add to that and the difference between the two?
No, I think you did a great job, Siobhan.
Thank you so much. So we just really want to highlight the difference. Oftentimes, the feedback that we get sometimes are when our women veterans are newly enrolled and they are assigned a comprehensive women's healthcare provider. Unfortunately, there are times where you're not explained the difference. We have changed our process here, and our lovely social worker, Miss Maisha Pope, makes calls to kind of go over and review for all newly enrolled veterans the level of care and services and how we can go about coordinating care appropriately and managing care care appropriately. We want to make sure that you're assigned to the right care team from the start, so it makes it easier to coordinate care and move things forward appropriately. We'll talk about our menopause care, and we actually have two clinic options that are available for you here at VMX. So the first is our GYN menopause clinic. This is led by gynecologists or our women's health nurse practitioners, and they are, in essence, our experts when it comes to hormonal and reproductive aging. They can provide a comprehensive evaluation and management of menopause-related symptoms. So sometimes this care may start with your comprehensive women's health care provider, and they want additional feedback or support for someone that has specialized in this level of care. And they may send a referral over to the GYN team because most of the times they have specialties, concentrations in this area that is specific to menopause level care. This can include providing support for vasomotor symptoms, genital urinary syndrome of menopause, mood changes, as well as sexual health. They are able to conduct adult physical exams, order labs, imaging, and even perform some diagnostic procedures if that is needed. They also are able to prescribe and monitor your hormone replacement therapy, including complex or high-risk cases. So, for example, veterans that may have a history of cancer or have clotting disorders or any other diagnoses that are concerning where a comprehensive women's healthcare provider still would like that higher level of expertise. They offer a multidisciplinary approach when needed. So that means that they are consulting and working together with our endocrinology office, urology, and psychiatry if needed. And at times they can tap into Dr. Austin for any additional questions when it comes to that. They can manage comorbid gynecological issues that may impact menopause care. So things like thyroids or abnormal bleeding. This is the ideal for patients with complex health histories and those requiring maybe a combination of procedural care alongside of their menopause management. So this is where we go for that initial sometimes diagnosis, procedures, and more complex levels of care when it comes to our GYN menopause clinic. Then we have our pharmacist-led menopause clinic. That is within our women's health clinic here in Baltimore. And this is led by a clinical pharmacist. That would be Dr. Kat Sanchez Vega, who specialized in training specific to menopause and hormonal therapy. So she is certified in that for us here. She focuses on medication therapy management, which includes counseling of risk and benefits of heart or over-the-counter supplements and non-hormonal alternatives. She can provide detailed medical reconciliations, assessing for drug interactions, particularly in patients with multiple chronic conditions. So if you have a vast history of complex medical conditions on top of your menopause, they are able to do the appropriate med reconciliation to ensure that any meds that you've been started on for menopause are not having any effects with any other medications that you may be taking. This person often collaborates and works with our comprehensive women's healthcare provider or our GYN providers to implement or adjust treatment plans as needed. The services here can be provided remotely, telehealth-based services, or on-site in person. What's key to recognize and remember is our pharmacists are not going to perform physical exams. They're not going to do diagnostic procedures. They are not going to be the one to initially diagnose your menopause. That's going to be done by either the comprehensive women's healthcare provider or your GYN specialty. So most patients that are going to be referred into the pharmacist clinic has already had a diagnosis of menopause and has already been started on some type of medication treatment. This clinic is ideal for patients seeking medication-focused guidance, some additional education regarding their meds, or ongoing support when it comes to adjusting their therapies appropriately. So that leads us into kind of full circle and talking about reproductive health a little bit, focusing on our in vitro fertilization, often termed IVF, which is a fertility treatment where fertilization occurs outside the body in the lab before a resulting embryo is transferred to the uterus. So the reason why we are focusing on IVF, because as we have changed our medical benefits when it comes to the VA's approved coverage for this type of service, what we've noticed is we've gotten a lot more referrals coming in for IVF. And with those referrals at times, sometimes there has not been a fertility workup, or oftentimes we're not quite sure of the cause of any infertility concerns, and getting this process approved has changed a little bit. So when we talk more into depth and detail, IVF is the process of extracting eggs and sperm, combining them in the lab, and then allowing an embryo to develop, and then transferring the embryo to the uterus for implantation. This type of care is going to start with an infertility consult. So either your comprehensive women's healthcare provider, sometimes this can be a specialty. We've seen endocrine sometimes may request an infertility consult. We've seen services like medical oncology request these type of consults because maybe the treatment pathway may lead to a patient potentially being infertile. So an infertility evaluation is done with a partner in the community, a reproductive endocrinologist, and that person is going to be the one that creates and develops a treatment plan. And at times that treatment plan may consist with suggesting the need for IVF. The infertility specialist will then submit information back to us, where our providers here will place something called the 1334, which is an IVF consult. In order for IVF consults to move forward, there's a couple of criteria that we need. The first is you have to have an infertility diagnosis. And there is no list because the workup that your reproductive endocrinologist does, that list can be massive. It can be due to structural issues for both male and female. It can be due to medications that have been taken. It can be due to procedures. So there is no specific list that any clinician provider can provide to you of an exclusive list that are reasons for infertility. The other thing that is needed is a service-connected disability that has caused the infertility or the procedure that may have caused infertility. And generally, this information is found in your VBA letter, your Veteran Benefits Adjudication letter. The infertility team here works together with the veteran to ensure that we have that information prior to moving the consult over to a team. So now all IVF requests are evaluated by a fertility interdisciplinary team, and they are reviewing all records that have either been here within your VA, in addition to the records that have been sent out in the community, and then your VBA adjudication letter, which would be requested. So there is a packet that is put together, and that packet is submitted to the interdisciplinary team, which meets monthly to review several cases to either approve or deny consults for infertility, specifically for IVF. Once that process is done from the approval or denial, there's a letter that goes out in the mail within 7 to 10 business days of review of that consult. So whether approved or denied, veterans will receive information to let them know next steps from there. But that's our process for IVF. So the biggest thing is the VBA letter, and usually things are listed out explicitly, and that's why we need it. So at times, veterans may know why or what their service connected for, but some of those things in your letters have additional details. So as why. Other questions that we've gotten asked when it comes to the VBA letter, we're not concerned about the percentage. So many of you may be service connected for 30% for one condition, 40% for another condition. We're not as concerned about the percentage of which you are service connected. We just want to see that it's service connected. So to give a very tangible, like real world example, let's say that a female has fibroids. It has been determined that fibroids is the cause of the infertility, and that fibroid condition has also been listed in a VBA letter. That is showing that we both have the infertility diagnosis, and the veteran at the same time has been service connected for the fibroid condition. So when all of that is given to the team, then it allows the team to review all of the additional notes, records, and make a decision for approval or denial based on everything that has been put forth from your reproductive health specialists, as well as your VA providers who have documented within your treatment notes here. So now we get to move on a little bit to the fun stuff, our new happenings. So I love Dr. Austin. She puts together a robust list for us of support groups, and she does an amazing job managing that. That list is vast. So once we finish with this, if anyone is interested, we can link and provide that additional information so you have access to it. But it is a very lengthy and robust list, and our future or I should say past tense, forums, there's been a request asking for the list of support groups. There's also been a request to find support groups that are available to us after hours, and we are still working on that and managing that appropriately to find resources, whether within the VA that we are sponsoring and providing, or within the community. So there are after hours support groups available. We know that's been an ask, and we are still continuously working on that request. So first, what's up and happening new is our mental health occupational therapy. These are the services of which they do, and the contact information is below for Miss Ava. Her phone number is 443-421-5672. And the maternity health occupational therapy works on things like postpartum planning, stress management, breastfeeding support, self-care, C-section prep, infant care and development, guided imagery. She can also help with nursery modifications as well as wellness support. The next, which is exciting for some, is our Healthy Bowel and Bladder class. This class is monthly on the fourth Fridays from 10 a.m. to 11 a.m. Now, this clinic does require a referral from your women's health comprehensive provider. So they would place an integrative pelvic health consult, and that's what would work to get you signed up for this particular clinic if you're interested. So again, it is a referral from your comprehensive women's healthcare provider, or if you just have a PCP, because many of our veterans still have a general practitioner as well, it can come from that individual also. And the consult is going to be an integrative pelvic health consult to get linked to this particular class. And then lastly, we have our prenatal fitness class. This class is Thursdays from 11 a.m. to 12 p.m. They focus on things like cardio, strength, balance, and of course, pelvic floor awareness. You can have your comprehensive women's healthcare provider place this for result, but many of our pregnant veterans have a talk with either Maisha Pope, our social worker, Janita Robinson, our maternity care coordinator, or even Dr. Austin. And oftentimes, if there is any type of interest, this information is put forth so that it is shared. So this is a maternity class OTPT outpatient health consult. So again, this would come from members of the maternity care team that often place this consult if a veteran expresses any interest in wanting to have any prenatal fitness class, or if it is brought up in regards to our primary care provider, then they can also submit the request also. So just really quickly with our resources, a reminder, out of our 8 locations, Baltimore, our main campus, is the only location that has a women's health clinic. All of our other 7 locations provide comprehensive women's healthcare providers embedded within our primary care clinics. So though we are still reaching our goal as to striving to have a women's health clinic in our other locations as we continue to grow and expand, currently right now, Baltimore is the only location that has its own separate women's health clinic. All of our other 7 locations have comprehensive women's healthcare providers on site. And then here is the information for the Women Veterans Call Center. This is very handy and comes in help when you just kind of can't put your finger on where your resources are needed or where to get that information from. The call center has tons of our information and is able to guide and support care appropriately. If for some reason they are not able to answer your questions, then they get it routed to the appropriate team member. So usually these referrals are routed to me directly, and we have a time frame to turn around and respond. So oftentimes, many of the individuals that are on the call with us this evening help to process, help reach out, and help to prioritize the level of care that is needed once these type of referrals have been received. So, okay, I'm going to turn it back over to Dr. Marshall because it is opened up to all of you guys for any questions that you guys may have for us.
All right. So thank you, Dr. Kirksey, for a wonderful presentation of all the different activities we have going on. So at this time, we'd like to hear from our women veterans. Please enter your questions into the chat box, and we will be, so as we're waiting for the first question, it says to be entered, we want to remind everybody, we don't want any privacy violations, so please do not mention any personal health conditions or personally identifiable information. If you have a very specific medical question, we're going to ask that you contact your VA provider and discuss it with them. But we're open for other general questions and information about the things that were presented tonight. So I'm going to go ahead and wait for the first question to come up. I will read it, and then we'll have the panel members answer. So I'm looking. I see we have the AI person here, the AI assistants here. We have a veteran who would like to receive the links for the different resources you mentioned, Dr. Kirksey.
Yes, I'm working on that right now.
Okay. Okay, this just dropped into the chat. I know it was a lot of information that was presented in a short period of time. So this is your opportunity to get more clarity or an explanation of anything that was presented. We do have an infertility committee that meets regularly to go over requests that we have. If anyone has any questions related to that. Does the VA, DC, and Virginia have same or similar services? Dr. Kirksey, I know you keep in touch with our
So
sister
yes,
facilities.
I keep in contact with DC. There is a Women Veterans Program Manager similar to myself there. Her name is Shana. She does host annual forums. Their VA is just slightly larger than ours, but they do have this comprehensive team that we have here as well. They also do have a pelvic floor physical therapist. So a number of their resources are very similar to ours. At times they may have a little bit more. So for example, for their GYN, they have a GYN navigator that helps kind of navigate and coordinate care with their gynecological department there as well. So at times, depending on the size of the VA, there's additional resources that are available.
But we have a pretty fantastic program here, so happy to have you. The next question we have is, are there resources besides the prenatal care and maternity care?
So yes, we have several additional resources. I am working in the midst of while I'm answering questions to drop the one additional link. And Dr. Austin, if you have it at your fingertips, you can drop for me. But I'm working on dropping those additional links and resources. Like I said, we do have comprehensive women's health care. That is just general clinic, but we do have several additional support groups like Woven that is available for us. There are support groups with Lindsay and her team, which works with intimate partner violence. They do strength at home. So we will work to drop some of these resources within the chat for you so you have access to those flyers also. Thank you, Dr. Austin.
Sure. I just wanted to add a quick point to that. So I dropped the current groups in the chat, but just this is a caveat. Some of these groups are embedded within certain clinics. So you have to be participating within that specific clinic. So I tried to kind of list which one those were. And then some kind of are closed groups, some are open and rolling. So I'm happy to drop my number in the chat just to be a liaison to get to any of these specific groups, because sometimes that, finding the person to contact might be a challenge often. So I'll, make sure to add my number as well.
Yes, I think there were about 6 groups that you dropped in there. So it gives a little description of each one. We do have a question. It is, can you clarify what gynecological support a woman postmenopause should be getting? I was told I no longer needed PAP exams.
So Dr. Starpoli, do you want to weigh in and start?
Yeah, I can answer that. So I think the question was someone who was postmenopausal. Well, it depends upon your individual clinical situation. So it depends upon if you still have a cervix. For example, if you had a hysterectomy with your cervix taken out, there are certain situations where we would do a pap smear, usually if people have had some kind of cancer, but in general, we don't. But right now it's recommended to continue to get pap smears up to the age of 65. And that's for somebody who's at average risk. So people who have had any kind of abnormalities or HPV on testing, they would continue even further.
Thank you. So we do have a question. Do we have to be in menopause to go to the GYN menopause clinic? Can we be perimenopausal and still enroll or be seen?
Yes, you sure can. You can.
That,
So you can be
that's when you need it,
perimenopausal.
isn't it,
Yeah.
Siobhan?
That's sometimes when we hear a lot of our veterans need it the most. They're in that
Yes.
in-between state and they're having a number of symptoms and just want help and support through that part. So yes, they can also handle perimenopause related symptoms as well.
I wanted to just add that it's Kathy Starpoli, that we also have some resources through our nutrition department to help with weight management. We have the MOVE program, which is a program about movement and weight loss. And we have nutritionists as well. And I know this is something that we have a lot of women asking about recently. And I'll try to find, we have a walk-in dietary clinic here in Baltimore on Wednesdays. But otherwise, you can easily be referred and you can self-refer to the dietary clinics as well, the nutrition clinics.
So I see Dr. Austin has put her phone number in the chat. She says she's happy to liaison with any of the programs or the groups that she listed in the flyer that she attached to the chat box. And Dr. Kirksey put in a couple flyers there. Dr. Austin, for those who may not be able to get the chat, the other groups that you mentioned in there was an anger management group, there was the intimate partner violence group, military
Yeah.
sexual trauma.
Yeah, they're broken down into various categories. So we have some under mental health and social work. So that would be your kind of general women's mental health groups, several embedded within different clinics that cover all topics related to women's health and mental health. Yes, our military sexual trauma group. And yeah, there's pretty much a lot of different topics. Intimate partner violence. We have our perinatal, both prenatal groups and postpartum groups included outside of mental health as well. So you'll see on this list several for our maternity PTOT, the whole health groups. We have women's veteran spirituality group. We have a women's health specific group for chronic pain. A women's drumming circle. And then at the end, there's a list of some community groups that are specific for women veterans. So definitely check them out. The flyers are embedded as well.
Thank you. We have another question. The individual said they came on a little late and they wanted to know, do we do mammograms and do we do 3D mammograms? And I would like you to also talk about the extended hours we had for mammograms recently.
Sure. Yes, we do mammograms. We definitely do 3D mammograms. We also do any diagnostic mammography that may be needed. We have extended hours for weekends, as well as some late evenings. Our late evenings, Monday through Friday, can go on those clinic days until about 6 or 7. Weekends are generally when they host, and I think lately it's been 1 or 2 Saturdays within the month, and those are generally anywhere between 8 to 1. To help support the needs of veterans that are working. Also, our weekend clinics that we've established for that has been available specifically to help support any veteran that has experienced MST. Sometimes our waiting rooms are a little busy, a little challenging, a little crowded, and it provokes additional anxiety and stress for one that's coming in to get support on such a delicate procedure and can be troublesome from what we've heard for a number of our women veterans. So we've established those weekend clinics specifically for that because it allows for any of our veterans to kind of come in where it's quieter. There's not a lot of traffic moving around, things like that.
Okay. One individual, we have a technical issue, is having trouble downloading the flyers That technical issue is beyond me, but is there another place they can get the information, Siobhan?
Yep, I'm taking care of that right now.
All right, very good. Thank you.
Mhm.
Okay, so there are one individual is asking in. So with 0 known personal abnormalities and all organs intact, but a mother and grandmother who died of ovarian cancer, how do I get a referral for the recommended transvaginal ultrasound each year? Want to give that to Dr. Starpoli?
Yeah, you just need to discuss with your primary care physician about this. We do transvaginal ultrasounds here. And any other high-risk screening that would be done in terms of blood work, we also do here. We also work with some GYN oncologists in the community who often follow people that are at very high risk for gynecologic cancers. So I would say discuss with your physician.
All right, so we have another person that's asking the same question as well. Dr. Kirksey indicated if you send her an email, she can help share the different flyers and information that we're presenting on the call tonight. And she has that in the chat for individuals. So people should realize that if we don't have a service physically at the VA that's needed for you, we do have a mechanism for community referrals, and we have a network through Optum, preferred providers that our veterans are eligible to see, and they range across different areas of the state. Okay, where is here that the TB ultrasound and blood work is done? I am local to the Fort Meade area.
So if you are in the Fort Meade clinic, then your provider there can provide the consult here. If coming into Baltimore is
Yeah.
not a challenge for you to get on campus, then we will provide it for here at Baltimore, where they would be able to do the transvaginal ultrasound, as well as your lab work. So you can come here to have that done directly at the lab. And then if for some reason, sometimes we have veterans that say the distance is an issue, though you go to Fort Meade, maybe you still travel quite a bit distance to get to Fort Meade. Your provider can put in a care in the community consult to have that transvaginal ultrasound done as well. As far as blood work, though, I am certain that Fort Meade draws their labs there, so there would not be a need for you to come to Baltimore for lab work.
Yeah, they definitely can do the lab work there. Another service that I did want to talk about is genetic testing. And we are working through a large VA network that is based out of Duke University and the Durham VA that does telehealth consultation concerning genetic testing. And they can order the whatever tests they think are needed. The blood work can be drawn here. And then they can discuss any kind of future screening or testing results with people who are at high risk for any sort of cancer or who have relatives that have been tested with, for example, the BRCA gene, which is pretty well known for breast cancer. But yes, where people have cancers that run in the family, they can become part of your care team there as well, and at least give us some recommendations of how to be followed or what might be done or who else in your family might need to be tested.
And by here, I think that's what they keep asking. So by here, you mean in Baltimore. So all of our imaging and specialty care is at Baltimore. What we have at the community-based outpatient clinics are the comprehensive women's health providers who can do your general wellness, your reproductive health. They can do preventive care, care of your chronic diseases, and they can make referrals for other specialty care. Okay. Okay,
You're
so she's
welcome.
yeah, I think I may have a question in the other box. Do we offer Ozempic for weight loss?
The one question that I feel like we can't answer. No, we do
So,
answer. We are able to, well, our pharmacist is not on the call tonight. We are able to provide it, but I know that there are a number of some of our weight loss medications, and maybe Dr. Starpoli can answer a little bit more, that are like on back, meaning it's a little challenging for us to get the meds in stock. But yes,
so,
we are
so,
able to.
so I can answer that part because I know
Okay.
we can now get the medicines in stock.
Yay.
Ozempic, we carry Wegovy, and there's actually on a public facing website the criteria for those that are eligible to get the medications. But I'll let Dr. Starpoli go. So the good news is that it's now available.
Yes, so there's a wide variety of different weight loss medicines. I think probably the most well-known are Wegovy and Mounjaro and Ozempic and all the different injectable medications that are advertised. So there is a tiered system here, and you do need to qualify to get this medication. And like Dr. Marshall said, there are public facing um, uh, uh, websites that can go through all of that. I think this is very common right now with all insurers. We do have it here. It is used for diabetes. There are certain conditions which we can use it for weight loss. But
And
we
I
do
know
offer
that
other medications that are not as restricted.
yeah, and I do want to let people know that as part of the comprehensive approach to weight loss or weight management, lifestyle changes and lifestyle assistance, whether it's through the nutritionist or through exercise programs, is also part of the requirement to receive Wegovy and the other medications. They just did actually vote on opening some additional tiers to individuals being eligible for the medication. And the reason that they had the tier system to begin with is, as Dr. Kirksey had mentioned, initially it was very difficult to get the medication. So the tier system was set up for those that were at greatest risk and could benefit the most from the therapy, that they were put at the top of the list. So now we're moving down the list as more people have been offered medication, have enrolled in our programs. This medication has become more available. So it's definitely worth asking. And the endocrinology clinic is very good at evaluating each individual and letting them know what their treatment options are. You're on mute, Dr.
You're on mute.
Starpoli.
Sorry, I was going to say our women's health pharmacist is also working with the various primary care teams in terms of following up after prescribing as well. But yes, people do need to be in a weight loss program. Like, for example, I mentioned the MOVE program before is our VA sponsored weight loss program, but people can also be involved in outside weight loss programs like Weight Watchers or something like that.
YMCA for exercise, or there's a whole list of ones
Yeah, they're
that
called comprehensive weight management
Yes.
programs.
Yeah. So they'd like to know how to enroll to get evaluated for weight loss and the medications.
So you can speak with your primary care doctor about it.
And what it is a consult at that point, if they were going to refer them to be evaluated for that, right, Dr. Starpoli?
Or they can do it themselves, yeah, but they
Yeah,
can
that's
also
correct.
consult to, we do have a nurse practitioner that works in our endocrinology clinic that really, that a lot of patients are moving through her as well. It's part also of a pathway for bariatric surgery as well for some people. But yes, you can just ask your primary care physician if they, if they can discuss this with you, or they can refer you to somebody that can.
So, Dr. Marshall, there was a question that came through and I asked for clarification. And so the question was about if someone was uncomfortable with the clinic. I asked to clarify what clinic, and they spoke of the Women's Health Clinic. So, no one is mandated to come to the Comprehensive Women's Health Clinic within Baltimore, which is why we have comprehensive providers within our primary care clinic. So if you're uncomfortable for whatever reason here at the Women's Health Clinic, you can still have access and see a comprehensive women's health care provider at any of our other locations. So be it that Fort Meade, Glen Burnie, our Eastern Baltimore campus, wherever your location is, Loch Raven, you do have access to see a comprehensive women's health care provider in one of those other locations. What they tend to do at those other locations is ensure that you are on a hallway at times that is specifically women's healthcare providers, and having access to things like restroom in the appropriate space and distance from the exam rooms as well.
And they want to know how to contact someone if they're interested in the weight loss program.
So there isn't a specific point of contact, because that's going to start with your comprehensive women's healthcare provider. So if you have a comprehensive women's healthcare provider, it would start with that person or your primary care provider. They would be the initial point of contact to discuss with you weight loss and your goals. And then they would make the appropriate referral that's necessary, whether that's for the MOVE program or whether or not you're interested in something in the community that would be more ideal. As Dr. Starpoli mentioned, there's Weight Watchers, there's Curve, there's a number of comprehensive weight management programs.
Okay, Fort Meade said I had to start the Army weight loss program.
Kim, I need you to verify with me offline. I think my email address, I'll drop it again, and you can verify it with me, because if you are still active duty for some reason, but I'm not sure why you would have to follow it with the Army. So that seems more of a one-on-one. So please reach out to me so that we can talk directly regarding that.
Okay, and then I'm really excited. We have a veteran who's asking, how do we get assigned to a women's comprehensive healthcare provider?
So you should already be assigned to one. And if you are unsure, again, that's a separate, let's take that offline and let me take a look. So we need to take a look at you in CPRS and see that who you are assigned to. And I can tell you whether or not that person is. Honestly, they don't go around advertising that they're comprehensive women's healthcare providers. Maybe we should get a button for them that says that. But I can take a look at your CPRS and see who you're assigned to and see if they're a comprehensive women's healthcare provider.
And if not, then you can help them with that, right?
Correct.
And what if they're a new person and they're not enrolled with us yet and they want to get enrolled and get assigned to a women's comprehensive healthcare provider? How do they do that?
So that is done with enrollment. So enrollment has been given the information and the listing of our comprehensive women's healthcare providers based on location, depending on where a veteran would like to be seen. So they have that list and they will ensure, but we double down because we know sometimes that doesn't happen. So that's where Ms. Pope comes in when she is doing that initial intro phone call with our newly enrolled veterans, to ensure that they do in fact have a comprehensive women's healthcare provider if that's what they would like. If they have already seen someone else, then we work together. She will tag the team on her notes, so we ensure that you are changed to a comprehensive women's healthcare provider moving forward.
And you talked about going to the enrollment center at Baltimore. For people who haven't been to Baltimore before, where is that?
It is on the first floor. It's as soon as you come up from the garage and you step off of those elevators, it is going to be in the corner to the right. It's the first thing you see right next to the pharmacy.
And at the same time that you get enrolled in the system, you can also talk to someone about enrolling in our electronic message service, called My Healthy Vet. You can look up appointments. You can look up care that you've received. You can order medications. You can we call them secure messages. So it's emailing your team if you need something or you have a question. So it's great service, and they're right there in the enrollment center. And if you don't have that service and you are enrolled with us, we can still get you into the My Healthy Vet system. It's wonderful. Okay, I'm not seeing any more questions right now.
It's wonderful. We have a nice group here this evening.
Yeah. So I will say this, a lot of your feedback, especially regarding the move and weight management, you've kind of given some of us our topics for our next biannual forum. So we use avenues and venues like this, our biannual forum, as well as we attempt to host quarterly focus groups. Now, those are smaller and tighter. They cap at about 9 veterans, where we get to focus on immediate concerns that those veterans may experience. And so please stay on the lookout for that. That information is always posted on our social media pages so that you reach out to me directly and say, hey, Siobhan, I'm interested in participating in a focus group. And when the next one is scheduled, I'll give you the details. And if you're able to join us, wonderful. And if you're not, it's okay because we host at least 4 of them a year.
Okay, so we have a comment from one of our veterans who says this is the first time that she's heard about comprehensive women's health care provider. She's seen at Perry Point and she wanted to thank us so much. So absolutely, when you go to Perry Point, you can check in and we can see about making sure that you are enrolled with the comprehensive women's health care provider. I know some individuals who've been in the system for a while may have been assigned a primary care provider. And I know we've worked diligently to try to transition them to a comprehensive women's health provider, but we can absolutely assist you with that. As Siobhan said, we can look up and see who you're assigned to and make sure that you have that type of provider assigned to you.
Correct. And sometimes what we see, if you have been with the VA for a while, as Dr. Marshall has said, you may have a PCP, but they may then send you to a comprehensive well women provider to do your routine well women exam. So your pap smears, your HPV testing. And sometimes it may not be clear that that's why they're sending you to someone else. And that does allow for you to have the opportunity to change. And so sometimes that's the piece that gets missed in translation. If you would prefer one provider that can do it all, then we can help support that. We have some veterans that enjoy their PCP and they just go see that primary care provider just once a year for when they need that routine well woman exam, or if there are any well woman exam issues or concerns, then they may see that person also. So I understand and I get it, which is why we're reaching out. So if you guys have questions or concerns and you're not 100% sure, please feel free to reach out. I will look up and verify information for you.
All right, we have several people who are happy to hear this information. I'm sure we'll be contacting you this week. Okay. Any other questions? We're coming up close to the top of the hour. All right. Well, seeing this pause at this time, I want to thank everyone for joining us today for our Women's Veterans Forum and participating in tonight's event. Your participation will help us to better understand your healthcare needs as we work to ensure that we are providing safe, quality, and compassionate care in a sensitive and welcoming environment for all of our women veterans. It's been an honor to take care of all of you. I can remember when we were a fledgling clinic and just opening, and we have really expanded based on the feedback we've been getting from you and the needs that you have. And you can see there's a whole team of people here in different specialties with different expertise to handle whatever need that you have. So thank you for joining us.
Thank you guys so much. Have a great evening.